Hello again. Well, we've got a treat for you. We're going to be talking about sports, particularly endurance sports and elite sports at Olympian level. Now, 20 years ago, the idea that somebody with type 1 diabetes could compete at that level or at that extremes of endurance would have been completely unthinkable. But today we have an increasing number of Olympians who live with type 1 diabetes. So Steve Redgrave, for instance, 5 gold medals, absolutely astonishing. Now, to talk to us about how that's happened, how it's done, and what the particular issues are, I'm delighted to welcome Professor Tomasz Klupa, who's coming to us from Krakow. Hello.
Hello.
So how has this gone from not even being possible to having gold medal winners all over the place?
I think that the passion is a key issue. The passion of the patient and the passion of the doctor. With the passion, everything is possible. And this is absolutely the key issue in this area. The second important issue is the technology. Technology has evolved dramatically, and nowadays with modern developments as far as technology is concerned, like continuous glucose monitoring systems, like insulin pumps, like hybrid insulin pumps, practicing sports, endurance sports, professional sports is much easier than it used to be like 15 or 20 years ago.
So what are the particular problems that athletes face? Let's pick any sport you like. What are the so for instance, like an endurance sport like running, or perhaps a fast takeoff sport like rowing?
Yeah, I mean, each sport has its specificity. There are the glycemic patterns around sport activity depends on many factors like age, like sex, like fitness, and the type of the sport. So glycemic patterns following aerobic sport like running will be totally different from interval sport or resistance exercise. So everything depends on the type of the sport. My first experiences as far as professional sport is concerned was related to combat sports. And this was a challenge because combat sport is a challenge, is a mixture of different forms of activities, including interval activity, aerobic activity, and resistance exercises. And we had to apply individual approach to the trainings, to the fights, and eventually we succeeded. So I have the patients under my care who on one hand can be champions in their weight limits, and on the other hand, the metabolic control is really acceptable. HbA1c is usually 7.1, 7.2, so it's really acceptable. So again, everything depends on the type of the sport, and we need to apply individual approach to the patient's trainings.
Presumably, it's not just getting them through the actual event or competition, but actually what happens to them afterwards, because some people I know a particular problem has been unexpected hypos after the event. How do you cope with that?
Yes, you don't become a professional sportsman during 1 week or 1 month. It's a long-term process during which you learn what you can expect from different types of exercise, what can you expect after regular training, and what can you expect after competition. So for professionals, I don't think it's a problem. For professionals, the real problem is when they end the career, and that leads to the deterioration of metabolic control. This is the phenomenon that we often observe. So for a professional sportsman, it's much easier to control their blood sugars when they are active sportsmen than after their sport retirement. So again...
That's presumably because they've built up a huge muscle mass. and the muscle is helping them in their glycemic control.
Definitely, that's true, but also the daily patterns of behavior, which are somehow in line with their professional activities, helps to control glycemic patterns. Whereas when they retire, then they usually change those patterns of behavior. The physical activity goes down, and that implies the change in the insulin management, and sometimes it's really challenging for those individuals.
So, Professor Klupa, what would you say to the average diabetologist? And I know none of you are average, you're all special. But what would you say to the average diabetologist faced with a person living with diabetes in their care who says, I want to compete in this particular sport? How should they approach that?
Yes. Okay. So as far as regular physical activity, I think that every diabetologist should encourage their patients to be as active as possible and also to practice amateur sports. But as far as the professional sport is concerned, I would suggest referring to those diabetologists who somehow specialize who are specialized in sport activities, because practicing sports means not only insulin management, it also means, for instance, diet. Sometimes it means psychological intervention. So if your patient wants to become a professional sportsman, then please refer him or her to the specialist.
But above all, don't tell them that it's not possible.
Oh, definitely no. Everything is possible. So I have under my care patients from representing each discipline that you can imagine. I have combat sportsmen. I have football players. I have hockey players. So anything you can imagine is possible with diabetes.
And the particular problem, I guess, for those in serious, high, elite competition is that you've not only got the physical problems of all the issues faced by people living with diabetes, but you also have this huge adrenaline surge, and for elite competition. Is that a big issue?
Yes, it is. So again, I started my adventure with professional sportsmen with combat sports. And as far as glycemic patterns following professional fights are concerned, everything or a lot depends on the course of the fight. So if my patient wins, it's much easier to control glycemic patterns as opposed to the situation when he or she loses, and it's due to this adrenaline and counter-regulatory hormone release.
That's a fascinating insight. Yes, look out for. And I think there's a similar thing about people that they are in a much worse mood if their football team loses. They're all.
Oh, yes, definitely. That's true.
But just very, very quickly, technology is key to this.
Yes, I think that the key issue is continuous glucose monitoring. Eating and being physically active are two factors that contribute to blood glucose variability a lot. So without systems that, on one hand, at any time show our current blood sugars and also predict what's going on to happen with our blood sugars during next couple of minutes, it's very tough to be effective in sports and to take good control of diabetes. And it's both related. I mean, you cannot be a successful athlete without good glycemic control. So this is the key issue. And another technology that helps a lot are the automated systems of insulin delivery, like hybrid closed-loop insulin pumps.
It's been an absolutely fascinating insight, and thank you so much for sharing it with us. Thank you, Professor Klupa.
Thank you very much.
Well, wasn't that fascinating? And it's worth problems if somebody loses a game. Who knew that? More later.